We're going to be going over your Gonal-f injection and your Menopur injections. With the Gonal-f pen, you're going to get multiple doses out of here. I believe you can purchase these up to 900 IUs. Let's just say Dr. Chalice orders 150. So you just dial the pen to 150, and if you over dial, that's fine. You can always go backwards, which is really nice about this pen. So on the window, it will say 150. And then you would just take this off, and you're gonna have a tiny little needle, and it kind of just screws on, which is nice and super small. You'll just get your alcohol pad and clean off your injection site. These are going to be sub-Q injections, also as belly injections. Above, below, or either side of your belly button is a good choice. You'll just clean the area and then make sure you dry it off. Squeeze the area like this, and it's gonna go in right like a dart. Push all the way down to make sure your meds go in, and then it will say 0, so you can know that you've used all your meds. With the Menopur, you have 2 little vials. You're gonna have your Menopur and then your sodium chloride. You'll have a syringe and a Q-cap, which is gonna be in place of a needle to pull the medicine out. You don't wanna use a needle instead of the Q-cap because then you'll dull the needle and it will be more painful. The Q-caps just kind of snap on, so that's kind of nice. You're gonna pull back to 1 for your syringe and twist this on, this Q-cap, and then you'll inject. Then you'll pull back 1 of the sodium chloride, and that just unscrews off of the Q-cap. Again, the Q-cap just snaps on and off, so you'll take that off of that, and then you'll place it on the Menopur, which is powder inside. Screw that on, and then inject the sodium chloride into the Menopur and just swish it around, and it dissolves immediately. You'll pull that back, and you'll pull it back to 1. If it goes a little bit over 1, that's fine. You just want to make sure you get all the medication out of the Menopur bottle. So once you're done with that, and then you'll have a needle right here. This is also going to be sub-Q, above, below, or either side of your belly button. Make sure you clean the area off, dry it. If not, it will burn. Pinch the skin and inject like a dart. And that's it, all done.